Hey everyone, welcome to another episode of the RAD Review. It's going to be a total Mondo rager. We are discussing radiology topics for the resuscitationist. My name is Rupal Jain from the University of Maryland School of Medicine, and this is episode number 9, the dot sign versus the spot sign. This episode, we're going to discuss the difference between these two radiographic signs seen on CT imaging of the brain of stroke patients. Now, the names of these radiographic abnormalities may be similar, but don't get them twisted. See, the dot sign is seen on dry CT of patients with ischemic stroke versus the spot sign, which is seen on CT angiography of patients with hemorrhagic stroke. Now, the important thing to remember is that if you see either of these signs, know that they both increase mortality. Let's jump into a case. Your patient is a 54-year-old male with sudden onset left hemiparesis and right gaze preference. Onset of symptoms 1 hour ago. Now, this is your dry, non-con head CT. What do you think? The radiologist calls you and says it's negative for acute hemorrhagic CVA. On your review, however, you're wondering about this hyperdensity, the dot sign, also called the middle cerebral artery dot sign or the Sylvian-Fisher sign. This hyperdensity is produced by thromboembolism of the M2 segment of the MCA, located within the Sylvian fissure. Now, because the occluded vessel courses in a plane perpendicular to the transverse plane of imaging, or in the axial section, it appears as a dot. This occluded vessel is hyperdense compared to a normal vessel because a thrombus containing erythrocytes, fibrin, and cell debris has likely already formed prior to embolizing from either the heart or the carotid bulb. Now, this is a useful early sign of ischemic stroke on non-contrast head CT, as it can be seen within 90 minutes of symptom onset. It is not sensitive. However, specificity approaches 90 to 100%, as the only real mimic would be a punctate vascular calcification along the M2 segment. In the same artery, you may have heard of the hyperdense MCA sign, which is also an early sign of ischemic stroke on non-contrast head CT. In comparison to the dot sign, the hyperdense MCA sign is the increased attenuation of the proximal MCA, signaling an M1 occlusion. As you can see, it appears more longitudinal in comparison to an M2 occlusion. Keep in mind, while the dot sign is a poor prognostic marker, the hyperdense MCA sign has a far worse prognosis. In terms of management, either of these findings should prompt CT angiography. While endovascular therapy and mechanical thrombectomy outperforms IVTPA in a proximal M1 occlusion, in the distal M1 or M2 segments, neither therapy clearly outperforms the other, and therefore, consultation with neurology at a comprehensive stroke center is particularly helpful. Now for a second case. We have a 63-year-old female with sudden onset aphasia and right hemiparesis with a very elevated blood pressure. The dry head CT shows this. The CT technician asks if you want a CT angiography, and you say, sure, why not? Let's evaluate for maybe a bleeding aneurysm or an AVM. Here is what you find on CT angiography. If your attention is to this hyperdensity here, you're onto something. This is what is called the spot sign. Essentially, the spot sign is a 1 to 2 millimeter focus of contrast enhancement compared to the surrounding hematoma, regardless of whether the shape of the spot is linear, circular, or something else. Now, the significance of the spot sign is that it is a predictor of intracranial hematoma expansion and therefore increased mortality. Now, this image below here is a dry head CT obtained about 10 hours after presentation, and unfortunately, it shows significant hematoma expansion as predicted by the spot sign shown above. The sensitivity of the spot sign, by the way, for hematoma expansion is only 63%, and therefore I don't want you to think that every time you see a spot sign that it necessarily means active bleeding. The specificity of the spot sign for hematoma expansion is around 90%, and multiple spot signs means even a higher risk of hematoma growth. The question then becomes, what do we do once we've identified a spot sign? Well, given the patient's worst prognosis, treatment should be aggressive and may include intensive blood pressure lowering, hemostatic therapy, and although the literature doesn't currently support a mortality benefit, you may consider recombinant factor VII or TXA. I want to thank you for tuning in to the 9th episode of the RAD Review. As always, we're going to wrap up with 3 RAD Review pearls. Pearl number 1, the dot sign signals M2 segment MCA occlusion, or essentially signals an acute ischemic stroke on non-contrast head CT. Pearl number 2, the spot sign, on the other hand, suggests an accumulation or extravasation of contrast-containing blood on the CT angiography portion of a patient with an acute intracranial hemorrhage. Pearl number 3, these are sound-alike terms for 2 very different neuroradiology findings in stroke imaging. Both, however, suggest increased mortality in stroke.